our next presenter. So we welcome back Jacques Le Houezec, who's an independent consultant in public health and tobacco dependence, scientist and smoking cessation specialist from France.
Thank you, Anne. Thank you all to allow me to show my experience from France. Moving from being a smoking cessation specialist, teaching clinical pharmacology of nicotine, I moved towards training vape shops and health professionals about vaping. I started this education about 4 years ago in 2015 for one reason. This is the reason why people die from tobacco. But everybody is afraid of nicotine. All smokers are afraid of nicotine. Vape shops owners and workers are afraid of nicotine because they are ex-smokers. So, in order to have them reassure the smokers when they enter their shops, we need to reassure them. We need to teach them that nicotine is not the culprit. It's combustion. Most smokers try to quit on their own. Just because most smokers are not feeling ill. It's not a disease. It's a behavior. Why should I see a doctor for that? And nicotine replacement didn't do a great job since it was introduced. Probably for two reasons. First, because it was underdosed. People don't use it at large enough dose and for long enough. And also because everybody has asked smokers to quit completely. Not to quit only tobacco, but to quit nicotine. Treatment was made for a certain time, except here in the UK, where the indication of harm reduction with NRTs have been introduced. Everywhere in the world, people are trying to quit smoking with NRT for just a couple of weeks or a little bit more. Vaping, I hate e-cigarettes term. I hate that. It's not a cigarette. Vaping is the solution. Michael Russell was right when he wrote that in 1991. If we want to get rid of tobacco, we don't need only to ask people to quit smoking and nicotine. We should offer them a substitute that they will use as long as they need, and Caitlin for relapse prevention, as long as they need, and if they need it for a lifelong use, that's not a problem as long as they don't smoke again. Nicotine was demonized because everywhere in tobacco control campaign, we've told smokers that the culprit was nicotine instead of saying to them that the culprit was combustion. So there is a clear need to educate vape shops because they are most of them, ex-smokers, and they are still afraid of nicotine. And if we see still a lot of dual use and a lot of going back to smoking, it's also because of that. Because vape shops are not trained to reassure smokers that nicotine should help them. Vape shops are public health actors. We need them. If we get rid of smoking, it will be because of vaping and vape shops. But the problem is that not every vapor, not every vape shop is giving the right advice for smokers to quit. Many of them just forgot where they are coming from. When they started vaping in 2011, 12, or 13, they were not cloud chasing. They were using a device with a tight airflow and high-strength nicotine. That's how it works. Cloud chasing and enjoying vaping long after you quit smoking, I have no problem with that. But if you want to switch a smoker to become a vapor, then you have to respect the natural route of quitting smoking with vaping. I'm sick of hearing that the nicotine cap in Europe is great. No. And the problem, the so-called epidemic of young people using vaping in the US and accusing Juul for that, this is just ridiculous. Every day, I would like to have a 50 milligrams nic salts on hand to help smokers. I went to Canada, Quebec exactly, in September, and I had to break the law. I brought back 36, 50, and 60 milligrams nic salts to help smokers that were unable to quit smoking with 20 milligrams. There is no risk of overdosing with inhalation. Smokers know exactly. They've learned that with smoking. They know how to titrate nicotine. But a smoker doesn't know how to vape, like a kid doesn't know how to smoke at the beginning. I used to smoke. I quit 36 years and 2 days ago. And at the time, I had to learn how to smoke without coughing. A smoker needs to learn how to vape without coughing. Why do they cough? Well, because in tobacco smoke, you have anesthetic substances which are not present in vaping. And also because smokers are afraid to take a deep puff with vaping. So they mixed a little bit of vapor with a lot of air, and that's more irritating than a full mouth of vape. That's how you should teach people to vape. A vape puff, is different from a smoke puff. It has to be at least 3 seconds. And it takes 5 minutes to teach a smoker how to vape without coughing. And when they realize that, you win. The first thing I do, because I do work in a vape shop very regularly, to teach vape shops and to teach health professionals, you have to know the work. And the field work is the best. It's like the clinical work for a physician. So the first thing I do with a smoker is to let them try flavors. Flavors are the first key. They have to like what they vape. If not, it's useless. The second key is the nicotine strength. And the third is teach them how to vape without coughing. And I would say that the fourth is to let them understand that they have to switch as fast as possible. Don't let them do dual smoking and vaping, because with experience I've seen that most of them will return to smoking. What I ask smokers is to try not to smoke for 3 days. This is acceptable for a smoker, just 3 days, and they try it. And if they succeed, it's done. If they fail, then something is wrong. You have to correct. And the first thing you have to correct is probably the nicotine strength, unless you're already at the top because of the limit in Europe. So usually if I have a smoker of more than a pack a day, which is very current in France, I can assure you, then we will use a patch over vaping. They will have the highest strength possible in vaping and the highest strength possible in patch. And that will do the job. Of course, and thank you for UK for that, we can also use vaping during pregnancy. And we also can use vaping plus patch in pregnancy, because we very often have in front of us a woman who is highly addicted to smoking, and always keep in mind that a pregnant woman is metabolizing nicotine twice as fast as when she's not pregnant, so she may need more nicotine. So the testing of liquid is one key. The choice of the right dose, and remember that if somebody is smoking roll your own tobacco, you can double the number of cigarettes at least. And you should know also that we should try absolutely to give the smoker the highest nicotine level they can support. It happened to me to start what we call light smoker, 4 or 5 cigarettes with an 18 milligrams nicotine liquid. Because when they smoke, even if they smoke only 4 or 5 cigarettes, when they smoke a cigarette, it's the same cigarette as somebody is smoking a pack a day. They need to feel something. So you need high-strength nicotine. The choice of the device should be appropriate, with a tight airflow, sufficient battery for lasting all day, and so on. So, in conclusion, over 4 years, I trained about 450 people in France, representing over 100 vape shops, including some in Belgium and Switzerland. Starting this year in March, we are very lucky in France to have a continuing education system that allows any employers who pay every year a fee to a national fund to get reimbursed when they train their staff. So since March, it's now a 3-day training. We are 4 trainers on different aspects. And if most of the staff of a shop is trained, they are allowed to have this on their window, showing to smokers that they are trained professionals. Thank you for your attention.